Welcome to Reddit Aliens. Doctors, medical examiners, morticians of Reddit. What is the strangest anomaly you found in or on a body? Please remember to like, share, and subscribe. A mummified fetus. I was working in Africa, and the usually very stoic Congolese surgeons called me into theater, gagging. The patient was an elderly woman with a protruding abdominal mass. When they opened it, they found that it was a long dead mummified fetus, which, as a result of an ectopic pregnancy, had somehow managed to both wall off after it died and somehow avoid killing the mother. Her body had encapsulated the alien tissue, and over the years, it had slowly eroded her anterior abdominal wall to the point where it finally caused her to have enough symptoms to get something done about it. It was horrific, and the smell was worse. Happily, though, the patient survived the procedure and just left the surgical team with a memory. When my mom was a mortician, I would hang out in the mortuary watching TV. Her boss showed me a guy who had retained water and drowned. His balls were the size of a grapefruit. Not the most pleasant thing to see at age 15. When you poked him, he moved like a waterbed. In med school, I had to do a pelvic on a woman during my EM rotation and found a meth pipe. She forgot she put it there during a traffic stop. I also had to remove a nail from a guy's head. He figured it must have went off while reloading. He had intractable tooth pain, so he got sent by his dentist for a CT, and lo and behold, there was a nail in his cranium. I mean, that could have happened to anybody, and I mean either of these stories. Wow. Wow. Guy came in for an outpatient MRI of his cervical spine. On the form where it asks if he ever had any metal in his body, specifically asks if any injured by any metal object, he selected no. Same with a verbal questionnaire. Also, we do a keyword search in the patient's hard chart for the term foreign body, in case it's documented. Nothing came up. He lays down, and I start taking images while talking to him through the speaker. During one of the image sets, he starts pounding on the inside of the scanner and screaming. Figured he was claustrophobic, so I stop the machine and get him out. Immediately, he jumps up and starts talking nonsense and runs into the wall, screaming he needs to get away from the ocean. I call overhead for emergency room staff to come down, and security, as he's flailing, continues screaming and running into the wall before we restrained him. The staff rush down, and he's talking a mile a minute and explaining how he is inside of the poster of the beach that covers the entire wall in the room he's in. Scared out of his mind and hallucinating, security restrains him, and he's taken down to get an x-ray of his skull. There was a BB in his frontal lobe. It had just enough ferrous metal left in it to travel a few millimeters in his brain. In the emergency department, he kept trying to escape and was very fast. While unrestrained, he got up, somehow convinced the guard he was better. Patient bolted out of his room into the main hallway. A code was called for a lost patient. For over an hour, nobody could find him until the nurse looked into a large storage closet. Poor guy was found in a pool of blood. He crashed into a large mirror that was leaning on the wall and had severe lacerations of his neck, face, and arms. Efforts were made to transfuse him, but it was too late. Still haunts me how a simple BB from 40 years earlier could do that. Discovered his brother accidentally shot him with a BB gun when they were kids. The weirdest thing I've ever faced as a doctor is also by far the saddest, and I still think about it every now and then. 5-year-old kid with oropharyngeal cancer caused by human papillomavirus, warts. She had been sexually abused since she was 2 years old or even younger by her father, which was now in jail, and got the cancer because of continuous oral sex abuse that caused papilloma to grow on her throat. No mother in sight. Was being raised by foster family. When she arrived to us, the growth was already blocking her trachea, and eventually she underwent surgery to remove the tumor, then chemo, then other 5 different surgeries. When I stopped working there, she was breathing through a tracheostomy hole and still under treatment. Bad prognosis. It's been 5 years since I left, and she's probably dead by now. And it haunts me, because no one told me in college that my profession would make me see the worst part of mankind. Neurologist here. We don't get as many cool stories as the ER docs. However, when I was in medical student, we had a cadaver with a very large and very tiger-striped tattooed penis. This was the only tattoo this man had, and was very unexpected when it came time to genital dissection. Obviously, this was saved by the staff for use on all of our anatomy exams. You walk around the room to different parts of the bodies and identify whatever is tagged, and this specimen was always identifiable by the only laughing medical student as they kept rotating around the room. Father owns a crematory. We once cremated a man with no clothes and not in any container, and along with his ashes came a massive belt buckle. I kid you not. We have no idea how it got in him, but it was definitely there. Teratoma consisting of a couple molars as an incidental finding in a pelvis x-ray. It was in the patient's uterus. Guy in his 20s who had a neck x-ray. It was discovered that the peg holding his head onto his body was congenitally absent, sans odontoid. It's probably a good thing he never played football. ER nurse. Man comes in after a car accident. We do a brain scan for safety and find a 3-inch nail embedded in his brain. Ask man about it. He says he has no idea. Admits he was once shot with a nail gun, but had no idea a nail had been lodged in his head. Had been there for well over 4 years. Interned with an ME, and we had a case where the death was very, very sudden. He didn't really complain about any pain or anything, and then was gone. We open him up, and there's blood behind a kidney. Almost an entire liter of blood in the cavity, with no sign at all of internal bleeding. Not really fitting with the question posed, but a medical oddity just the same. My mother-in-law miscarried twice before she had my husband and his twin brother. She had some kind of cyst or protrusion in her uterus that once one of the previous fetuses got to a certain week of growth, it would rub against the protrusion and rupture the sac, and the fetus would not be at a point of viability and would perish. So, when she became pregnant with twins, she knew inevitably she would sadly lose them at that stage. The time frame comes and goes. Fetuses are still okay and growing normally. It comes time to have them, early as with twins, and lo and behold, not only are they in the same amniotic sac, but the other twin sac is around the one they shared. They were double bubbled. They had twin transfusion syndrome, so no one at the time had a moment to think about it, life or death emergency at the time, but the fact that they were double wrapped is more than likely the only reason they made it that far. Both survived the twin transfusion, very rare in the early 80s for one if not both to die. Just an amazing story, I think. I absolutely love this post and this story. It's great to read something positive in an otherwise dark topic. And that's a miracle, believe it. A real grub inside a tooth. An old patient came to us with a long-term and severe pain in her tooth. The doctor extracted the tooth, then put it into a tray. After 1 minute, we saw a grub crawling out from the tooth. This woman had lived with it for at least 6 months. Whoa. I worked in medicine as an X-ray tech medical assistant. One day, we had a patient come in complaining of a stomach ache. Considering the time of year, it wasn't an abnormal complaint to have come in our family practice. So we run him through the normal test urinalysis and abdominal X-ray, KUB for those medically inclined. Well, he was a shorter fella, so I had a lot of room on the film. This kind of X-ray is one large shot centered on your belly button. It's mostly used to see how full of shit you are. I went to the dark room to process his film when something weird could be seen near his butt. There was definitely a lot of poop backed up, but I couldn't tell what was causing the blockage. I showed the doc the film, and she bursted out laughing. The doctor I worked with was usually stone-faced and serious about these kind of things, so it was odd. We were all confused. She asked me to go into the room with her while she asked him some questions. The first thing she asked him was what he shoved up his butt. I was so taken aback by this statement, I almost missed what he said. You see, this 40-year-old man has diarrhea the week before and decided to shove a tampon up his butt to stop it. He tried to take it out, but the string got caught, and then he simply forgot about it. We had to remove it. It was disgusting, and I never did another procedure ever again. This is what happens when you smoke. She isn't dead, but this week I saw a patient with endometriosis in her lungs. Somehow, womb lining cells have traveled to her thorax and colonized on the lung. She previously had symptoms of coughing up blood while menstruating, but because the endometriosis was so severe, was on the pill to stop her periods entirely. Then she came off it to have a baby, and after the birth, with her hormones all over the place, she developed 2 pulmonary embolisms, blood clots in the lung, and a few weeks after that, 3 successive pneumothorax collapsed lung. The womb cells had tried to shed, and made a hole between the airways and the sac surrounding the lung, letting air escape. She's deciding now to let the surgeons cut out part of her lung with the endometrial cells, to go back on the pill for life, or to have a full hysterectomy and remove her ovaries. Tough choice at 32. I was a combat medic in the army. Not super uncommon. About 1 in 10,000 people have it, but I had a buddy with situs inversus. All of his major internal organs were reversed, heart on the right side instead of the left, for example. As soon as he got to the unit, it was the first thing he told me. Wanted to make sure if he got hurt, I wasn't curious as to why he had no heart, I guess. Pretty memorable to me. I'm a doctor, was working in OT, anesthesiology. An emergency came in the afternoon. Apparently the patient is a fisherman and got into a fight with his fisherman friend. Patient was impaled by a spear gun. The spear entered just lateral to his belly button and came out just above his right hip. He actually held this 6-foot-long spear going through his body and walked into the emergency room by himself. When it was time to put him under, he wasn't scared or anxious. He just said, "Just fix me up so I can go find that guy." Not a pathologist, but I work in a coroner's office. On more than one occasion, we have directed a post-mortem on someone who has died abroad, often due to heart-related issues. I once got a phone call from a pathologist after he had opened the body to examine the heart. The person died from a heart attack, yes? Apparently so. You want me to examine the heart? Yes, please. Where is it? Some other countries routinely remove organs when they are determining a cause of death. Then the body is embalmed and sent back to their home country. We still often have to confirm the cause of death, so I spent a lot of time chasing missing organs around the world. Worked in a funeral home, had a friend at the medical examiner's office. A father was thought to have died of a heart attack, and he came to our funeral home. Next morning, the pathologist comes in and looks at the notes, calls us in a panic. We rush the body to the medical examiner's office. A few weeks later, I asked my friend what happened. The guy was actually murdered and was shot. This reminds me of a course I had in college, taught by the chief medical examiner of Los Angeles. He went through some of his landmark cases, and the craziest one was the story of an Iranian man and his wife. The man had a student visa, but the wife was denied one, so he tried to smuggle her out of the country in his luggage. When they arrived in LA, and he opened his bag to find her suffocated, he left it there. He committed suicide the next day. Super crazy story. I think there's a doc about it. I'm a carer for the elderly at a hospital. A nurse asked me to help her insert a catheter into a lady with dementia, but when we propped her legs open, there was a horrific smell, and we could see something dark in the vaginal cavity. It was a teddy bear. We think it was in there a while. Teddy Ruxpin. No. Bad Teddy Ruxpin. Do you guys even know who that is? I was a mortician for a religious organization, and I have to say that the butt plug conundrum of 2013 was among the more difficult issues I've faced in the field. A decedent arrived in my morgue with a bejeweled butt plug firmly in place within the rectum, which led to a very interesting issue. If the family had known that the deceased was likely to have had such an item, we'd be screwed if we didn't list it amongst personal effects to be returned to the family. But if they were as vanilla as most of the relevant religious community claimed to be, such an item would probably be considered a slanderous perversion. Fortunately, my boss was a member of the relevant clergy, so I simply removed the item and popped it into a biohazard bag for him to decide upon. Not me, but my boyfriend's mom is a doctor for people with special needs. One of her patients, an older man with Down syndrome, among other diagnoses, appeared to have extreme abdominal pains that lasted for weeks. They did several tests and tried medication, but the pain wouldn't stop. He also suffered from constipation and stopped eating altogether at some point. The source of his trouble remained a mystery for almost 2 weeks, and the doctors were starting to get desperate. Then, suddenly one afternoon, my boyfriend's mom got a call from her clinic. She's the head of the department, so they let her know when something important happens while she's not on duty. That this man had finally been able to go to the toilet, and among some stool was a blue latex glove. Over the following days, he passed about 20 of these in total, and he felt better, and luckily started eating again. Most likely, he had somehow been able to steal the gloves from the cleaning lady's cart and ate them without anybody knowing or seeing, causing the gloves to get stuck in his intestine while absorbing his digested food, filling up like a little poop balloon in his stomach. This really is one of the weirdest stories I've ever heard, but my boyfriend's mom said he had been known for eating weird stuff. Like this one time, he ate a t-shirt. Not a doctor, but my brother and I were the first for my mom's doctor. My brother and I are twins, but I was born a month premature. My brother was actually a few days overdue. My mom got pregnant with my brother, and a month or so later she got pregnant with me. Her body released another egg despite her already being pregnant. Because of the way we were conceived, my brother shoved me up under our mom's ribs. Her heartbeat concealed mine, so a month before my brother's due date, the doctor finally realized that there were two of us. This was in 1985. Ultrasounds weren't nearly as good as they are now. Edit. Don't use Reddit at 2 in the morning. I forgot I could edit my comment. I put some more information in another comment that got buried. Forgot to mention that I'm female, another sort of rare occurrence, and I was born breech. My mom told me that the doctor had to pull me out because I wasn't coming out on my own. To add to my mom's luck, I was sucking my thumb and tore her quite a bit because the doctor didn't realize my elbow was sticking up. Luckily for her though, my brother had already been born. First year of veterinary school, we are required to do a dissection on a dog and can elect to do a cat as well. One of the groups in my class opened up the chest of this cat that had died of natural causes, only to see its heart completely swallowed up by the diaphragm. For those of you who don't know what I'm talking about, the diaphragm is a really thin muscle in your chest that is a main contributor to breathing. This cat was born with a hole in the diaphragm, hernia, and had proceeded to grow around the heart like a little tent, making the heart more pillar-shaped than heart-shaped, and somehow managed to live almost to adulthood. So basically, the heart was half in the chest and also half in the abdomen, just casually brushing against its liver.